Hey guys, it's Menkes Perfect Snailus, where medicine makes perfect sense. Let's continue our biochemistry playlist. After completing our discussion on the water-soluble vitamins and the fat-soluble vitamins and the vitamin-like substance known as choline, we started talking about minerals. The last video was about zinc. Today's video is about copper. Some genetic diseases have deficiency of copper, such as Menkes disease. Others have an overload of copper, such as Wilson's disease. Does it make a difference? Of course it does. Copper is very important to your body. It is essential. For one thing, it helps you make collagen. It also converts the saturated fatty acids into monounsaturated fatty acids. So let's get started. Please watch the videos in this biochemistry playlist in order. Let's start with some interesting cases. First patient comes in complaining of, "Doctor, I'm tired and pale and tired. Sometimes I have angina, other times I have a murmur. I am short of breath. I have headaches, dizziness, and exercise intolerance." After doing some labs, we discovered that this patient has anemia. What kind? Microcytic. Which subtype? Iron deficiency anemia. But what's the cause? Second patient presents with poor wound healing, bone demineralization, removal of minerals like calcium, like phosphate, magnesium, etc. So, poor bone function, increased risk of fractures, and some hair problems. Third patient presents with nerve issues because of demyelination, loss of the myelin sheath. Why is that happening? Fourth patient presents with hypercholesterolemia, high cholesterol in the blood, which increases the risk of heart attacks and strokes. Fifth patient is a youngster with gray hair. What? Myocardial atrophy. What? Weight loss and leukopenia. Decreased number of white blood cells. His blood vessels are so fragile. And since the aorta is a blood vessel, this kid has an increased risk of aortic dissection or aortic aneurysm. All of these 5 patients have one thing in common. Can you guess it? All of them have copper deficiency. My first patient with iron deficiency anemia is copper deficient. The second patient with poor wound healing, bone problems, hand problems is deficient in copper. The third patient with demyelination has no enough copper. The fourth patient with hypercholesterolemia also lacks copper. Why is that? Because copper is important for an enzyme known as C18 delta 9 desaturase, which converts stearic acid into oleic acid. Stearic acid is saturated. Then copper should normally convert it to oleic acid, which is monounsaturated fatty acid, which is less evil than the saturated fatty acids. That's why, without copper, the saturated fatty acids will pile up. Hyperlipidemia, or increased blood lipid, increasing my risk of heart attacks and strokes. And the young buck has a defect in the genes, which lead to defective proteins that are responsible for transporting copper, especially during absorption. If I cannot absorb copper, if I cannot utilize copper, then there is no collagen. Collagen is important for hair, skin, bone, etc. Also, copper is important to make melanin. Without melanin, I have no pigment. Depigmentation of the hair, that's why this is a baby with gray hair. Moreover, copper is important in the electron transport chain, which provides you with ATP, energy. And that's why this child is tired, hypoactive, etc. Also, copper will help us absorb iron. Without copper, there is no iron being absorbed. That's why this lady developed iron deficiency anemia. But why do people develop copper deficiency? It could be because of malnutrition. It could be because they are in the hospital dependent on total parenteral nutrition, i.e. feeding through the veins because they cannot eat, and the doofus doctor forgot to add these essential minerals to the TPN formula. Ergo, copper deficiency. Moreover, other people are copper deficient because they take too much zinc. Zinc and copper are kind of enemies, especially in excess, because they compete for the same transporter protein in the gut. So if you're taking in too much zinc, there is not enough place for the copper to bind, which means your body will not absorb copper, and vice versa. If you take in too much copper, your body will not be able to absorb zinc and you will become zinc deficient, one of the most important facts in nutrition. But since most doctors and nutritionists and freaking dietitians have not opened a textbook in decades, they forgot. And we have students running around today asking, I don't understand what's the point of biochemistry. Why are we studying this? Shut up. Please watch my previous video on minerals. Remember, nutrients are either macronutrients or micronutrients. My body needs them in big amounts, or my body needs them in tiny amounts. Macronutrients, carbohydrates, proteins, and fat. Micronutrients, the vitamins and the minerals. Vitamins are either water-soluble or fat-soluble. Don't forget choline, which is vitamin-like and water-soluble. As for minerals, we have macro minerals and micro minerals. The macro minerals are calcium, magnesium, sodium, potassium, chloride, and phosphate. The micro minerals are iron, iodine, zinc, and copper. So copper is a micro mineral. Copper is a trace element. Copper is a microelement. Copper is micronutrient. It is essential that you take it, whether through the diet, supplements, whatever, because your body cannot synthesize copper from scratch. And we talked about the difference between cofactors and coenzymes before. Since copper is a mineral, it is a cofactor. Don't forget, copper is here. It's a transition metal ion. Most of the copper in your body is in the 2+ form, divalent cation. Copper is a microelement, a trace element, or a micromineral. Here's a lovely comparison between vitamins and minerals. Please pause and review. Since copper in your body is divalent and zinc in your body is divalent, it's not a far stretch to imagine that they can compete together against one another for the same receptor. Here is copper again. Daily requirement is about 2 or 3 milligrams every day. When the daily requirement is less than 100, odds are it's micro, not a macro element. Minerals are very important for your body for reasons that we discussed in detail in the previous video. They are cofactors, they are building units, they help in the catalytic processes because they are cofactors to catalytic enzymes. They stabilize your DNA and RNA. Copper, because it's a transition metal ion, plays a catalytic role, i.e., it's cofactor for catalytic enzymes. Pause and review. Copper exists in your body. It also exists in your blood. Most of the copper in your blood, you can argue that 95% of the copper in your blood is in the form of ceruloplasmin. I just love the name. What does IN mean? It means it's a protein. And where is that protein, please? It's in your plasma, which is in the blood. And what does cerulo mean? It means copper. That's why copper's symbol is Cu, from cerulo. So, think of copper as incorporated inside the molecule of ceruloplasmin. The rest of the copper in your body is either freely floating in the blood or loosely bound to albumin, which is a plasma protein. Let's say that I'm copper deficient. What's going to happen to my copper in the blood? Low. How about ceruloplasmin? Low. How about free serum copper? Low. How about the copper bound to albumin? Low. So, normally, who makes ceruloplasmin? Answer, the liver does. You need 6 molecules of copper in each molecule of ceruloplasmin. Who's going to help with this incorporation? ATP7B. Genes code for proteins. The liver will incorporate all of these copper molecules into the ceruloplasmin molecule, and then the liver will dish all of that ceruloplasmin into the blood. Now ceruloplasmin is in your systemic circulation. It will go all over your body. How did the liver excrete the copper? Also through the biliary system, which means naturally some copper will end up in your stool. Some will end up in the urine, and some will end up in your blood as ceruloplasmin. All of this is normal, but what if I have Wilson disease? Well, Wilson disease is a defect here in ATP7B due to an autosomal recessive mutation. What's happening is 2 things, 2 disasters. Number 1, I cannot incorporate copper into ceruloplasmin. What do you think is going to happen to the level of ceruloplasmin? Answer, low. Many students find this hard to believe. How come it's a disease of copper overload, yet the ceruloplasmin that has copper is low? I don't get it. Because the genetic defect is about failure to incorporate copper into the ceruloplasmin. failure to manufacture ceruloplasmin. That's why it's low. The second disaster, the body cannot eliminate copper into the bile. Oops! What's going to happen to that copper? Well, since you cannot incorporate it into ceruloplasmin and you cannot excrete it into the bile, all of that copper is piling up in the liver and other organs, leading to toxicity. Because just like iron, if copper is left free by the Fenton reaction, it gives us hydroxyl-free radicals. Free radicals or reactive oxygen species can lead to toxicity of these organs. And Wilson disease will have symptoms in your cornea, such as Kaiser-Fleischer rings, symptoms in the brain because of the copper deposition. Copper loves the basal ganglia of the brain, so you get Parkinson-like features, hemibolismus, even dementia is possible due to copper overload. In the kidneys, just like any metal, it is freaking toxic to the tubule, which can lead to renal tubular acidosis, which causes normal anion gap metabolic acidosis. And since it's a metal, it increases my risk of kidney stones. Yet, if you measure the patient's ceruloplasmin in the blood, it is low. But if I biopsy the liver, I'll find too much copper in the liver. See, medicine makes so much sense once you understand what the flip you're talking about. So let's dig deeper into copper structurally. It is an essential nutrient, it's a micronutrient, it's a micromineral, it's a transition metal ion. In your body, it's usually divalent cation, which means it's water-soluble, of course. In your body, you can find copper in muscles, bones, liver. What do you call it? Hepatocuprin. Cuprin from copper. If it ends in IN, it's a protein. Copper is incorporated in your red blood cell as erythrocuprin. In your brain, cerebrocuprin. If I have too much copper in the blood, it's called hypercupremia. If I have too little copper in the blood, it is hypocupremia. What's the main form of copper in my blood? Ceruloplasmin. Dietary sources that are rich in copper include beef, poultry, shellfish, nuts, cereal, dried beans, and fruits. Milk, however, is a poor source of copper. Adequate intake, about 2 to 3 milligrams per day. Its absorption in your intestine depends on a protein known as metallothionein, which is also important for zinc absorption. I've told you that both zinc and copper compete for the same protein in your gut. That's why excessive zinc leads to copper deficiency and vice versa. Excessive copper intake will lead to zinc deficiency. Functions of copper in the body are numerous. Here are just some of them. And don't forget, copper is important for the enzyme C18 delta 9 desaturase, which converted the saturated fatty acid, stearic acid, into the monounsaturated fatty acid, oleic acid, which is less evil. And that's why, for normal people who have normal copper, even if they eat stearic acid, which is saturated, they will be okay because it will be converted to oleic acid if you have enough copper, which means you have enough cofactor for the enzyme C18 delta 9 desaturase. Did you notice that desaturase will convert the saturated into something that's unsaturated? Desaturase. And that's why one of the symptoms of copper deficiency is hyperlipidemia, increased lipids in my blood. Next, copper is a cofactor for the very important enzyme lysyl oxidase, which is important to convert lysine into alysine, which is important for collagen and elastin cross-linking. And that's why symptoms of copper deficiency include without collagen. Remember, without collagen, my bones are poor, my blood vessels are poor, my tissue regeneration and repair capabilities are poor. Vessels are fragile, increasing the risk of aortic dissection or aneurysm, especially due to problems in elastin and collagen too. Next, copper is a cofactor for the enzyme dopamine beta hydroxylase, which converted dopamine into norepinephrine. So you can imagine patients with severe copper deficiency that they have low norepinephrine in their body. Their nerve endings cannot make norepinephrine. This can be disastrous for the brain. And their adrenal medulla is also having trouble making norepinephrine, which can be disastrous in fight-flight situations, such as running from a tiger. Next, copper is important for the enzyme tyrosinase, which helps us make melanin. Therefore, copper deficiency equals gray hair. Copper is important for the free radical scavenger superoxide dismutase, which will help you neutralize the superoxide into H2O2. Without superoxide dismutase, the superoxide will pile up, which is toxic to the myelin, to the nerves, to the heart, etc. Because free radicals cause what? Lipid peroxidation in the cell membrane of these organs. Next, copper is a cofactor for peroxidase, which converts the Fe2 into Fe3. This step is important in your intestine so that you can absorb iron. Once you do that, the iron will jump onto transferrin, and then transferrin will transport that iron to the target tissue, including your bone marrow, to make red blood cells. That's why without copper, what do you get? Iron deficiency anemia, due to failure of absorption and failure of incorporating the iron onto transferrin, failure of loading. Iron deficiency anemia is the most common type of anemia worldwide. Most of the time it's due to malnutrition of iron, but in some cases it's due to malnutrition of copper. So if your patient has iron deficiency anemia due to copper deficiency, you have two choices. Number one, to correct the copper deficiency first. If we do not have enough time, then give the iron not through the gut, but through the blood directly, so that you do not have to deal with this. But of course, you should correct the copper. Next, copper is important for cytochrome C oxidase in the electron transport chain, which means ATP, which means energy. Without it, you'll have troubles. Copper is also important in the steps that lead us to make myelin sheath around the nerves. That's why copper deficiency equals demyelination. So I've just told you about symptoms of copper deficiency, which can happen in genetic diseases like Menkes disease. It can happen due to severe malnutrition. It can happen due to total parenteral nutrition in the hospital when the doctor is a doofus, forgot to supplement copper. And it can happen if you're taking too much zinc. All of this is copper deficiency. What's the opposite? Copper overload. Maybe because I have Wilson disease, a defect in the ATP7B. Or maybe because I'm a doofus taking in too much copper. And as an ancient wise man once said, nothing in excess, everything in moderation. Remember that collagen type 1 is in bone, type 2 is in cartilage. Type 3, look at how flexible this is. It's in flexible blood vessels. How about type 4? Under the floor in the basement membrane. Type 5, hair and placenta. That's why if I have copper deficiency, my collagen is toast. I have bone problems, cartilage problems, vessel fragility, poor wound healing. Because remember that you need collagen, especially type 1, when you are repairing your tissue, and hair problems. These are the different steps of collagen synthesis. We have talked about it before in my video on vitamin C. Just remember that lysyl oxidase, which is important for the cross-linking of collagen, is dependent on copper as a cofactor. This cannot work if I have Menkes disease, because if I have Menkes disease, it means that I cannot absorb copper. I cannot transport copper. I have a problem in the copper-binding P-type ATPase, which means no copper, no lysyl oxidase, no collagen. Lysyl oxidase converted lysine into a lysine, which is important for the cross-linking of collagen fibers. Not just collagen, but elastin too. Copper converts proelastin into elastin for the cross-linking of elastin fibers. Do you remember your adrenal medulla, which can make epinephrine and norepinephrine? Do you remember your nerve fibers, especially the sympathetic nerve fibers, which can make only norepinephrine, but not epinephrine? How do they make these doozies? Phenylalanine, tyrosine, dopamine, norepinephrine. How do you go from dopamine to norepinephrine? By the dopamine beta hydroxylase, which needs vitamin C, which is lacking in scurvy, and copper ions, lacking in Menkes disease, or severe malnutrition, or total parenteral nutrition, or zinc excess. End result, I cannot make norepinephrine. Don't forget that depression is associated with low norepinephrine levels in the brain. Next, copper and the free radicals. Why do we need free radicals? So that you can make bleach throw it in the face of the bacteria and kill it. That's why you need free radicals. But without free radicals, what's going to happen? Well, I'm increasing my risk of infections, which increases the risk of poor wound healing. I mean, how would you heal if you have not cleared the infection? How do we make these free radicals? First, oxygen, then superoxide, very toxic. Who's gonna neutralize it? Superoxide dismutase, dependent on copper. So if copper is missing, this enzyme is toast. And if this enzyme is toast, who's gonna pile up? Superoxide. Good news, you can kill bacteria. Bad news, you can kill your own cells. If you remember my video on iron absorption, we have talked about all of this before. Remember, in order for your gut to absorb the iron temporarily, we have to convert the Fe2 into Fe3, the ferrous into the ferric iron. Who does that? Peroxidase, because this is oxidation. When you gain a positive charge, it's oxidation because it means that you lost a negative electron. Oxidation in chemistry is one of three things: gain of oxygen, loss of hydrogen, or loss of a negative electron. As in this case, I told you it makes sense once you understand what the flip you're talking about. Peroxidase is dependent on copper. No copper, no peroxidase, no iron equals iron deficiency, anemia. Say goodbye to your red blood cells. Say goodbye to transporting oxygen in your blood. I'm tired. I'm pale and tired. Does copper play a role in the electron transport chain? Yes, of course. See this cytochrome C oxidase, which belongs to complex 4 in the electron transport chain? It is dependent on copper ions. This will help me pump protons to the outside. Pump protons, pump protons, pump protons. Protons will accumulate here in the intermembrane space of your mitochondria, and then the protons will keep accumulating until they get sick and tired of being sick and tired. This gradient creates a push to the inside. Pew! Pump those protons to the inside, trigger a conformational change in the ATP synthase, make you some ATP for some energy. None of this will happen if I am copper deficient. Moreover, the famous enzyme monoamine oxidase, which degrades dopamine and norepinephrine and epinephrine once they expire and it's time to get rid of them, into degradation products, such as dihydroxymandelic acid, or VMA, or HVA, dependent on what you're breaking down. So there you go, everything you need to know about copper in one doozy slide. You can download my notes on my website. Some pearls for the pros. Aceruloplasminemia. Let's break this down. Emia means blood, IN protein, plasma, copper, no. There is no ceruloplasmin protein in the plasma, which contains what? Copper. So there is no copper in the plasma basically, due to a genetic defect. No copper, no peroxidase activity. No peroxidase, no conversion of ferrous into ferric, which means I cannot absorb the iron, I cannot use the iron, and more importantly in this disease, I cannot remove the iron from cells because I cannot incorporate it onto the transporter. What's going to happen when you cannot remove the iron from cells? Iron is going to pile up inside the cells, which leads to iron overload in the cells. Iron overload in my testicles will lead to infertility. In my pancreas will lead to diabetes. In my skin will lead to bronze discoloration. Together, these are called bronze diabetes. Iron overload is very toxic to tissue. Do you think your average doctor has ever heard of aceruloplasminemia? Or is he just another doofus with a stethoscope?
But hey, medicosis, it's a rare disease. Why should I care about it?
Then who in the world will diagnose these poor children? If you want to learn more about copper toxicity and Wilson disease, check out my video here on YouTube titled Wilson's disease. And to learn more about copper toxicity, cadmium poisoning, cobalt poisoning, lead poisoning, mercury poisoning, arsenic poisoning, and much more, download my toxicology course at medicosisperfectionalis.com. If you do not wish to download my courses and would rather watch them right here on YouTube, then click on the join button under this video or in the description and choose the highest tier to gain instant access to more than 300 doozy premium videos. Thank you for watching. Please subscribe, hit the bell, click the join button. support me here or here, go to my website to download my courses, notes, and cases. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.